There are a lot of misconceptions about borderline personality disorder. One of the more common misconceptions about BPD is the idea that it is incurable. Now, I am not trying to say that borderline personality disorder is always curable, but I am going to say this. It is pretty much the consensus in psychiatry and psychology that it can be cured. And when I say cured, I mean that there are many people with BPD who will get to the point where A, they no longer have borderline personality disorder, B, they no longer need any treatment for borderline personality disorder, and C, they will no longer have borderline personality disorder ever again for the rest of their lives, and they will no longer need treatment for it for the rest of their lives. You don't need to take my word for it, because in this video I'm going to provide several scientific, peer-reviewed sources that do show that indeed borderline personality disorder can, in many cases, be cured. Again, I'm not saying that it can always be cured, but the idea that once you have borderline personality disorder, you're always going to have it is just not always the case for many people with BPD. I also will be telling you about the details on some of the methods in which BPD can be cured. I will be giving you all the details about one of the most common ways it can be cured, and I will also give you some of the details about the other methods it can be cured. Unfortunately, I won't be able to provide all the details about all the methods in which it can be cured, because that's a little bit too much for this video. Okay, before I talk about how borderline personality disorder can be cured, let's talk about the criteria for having borderline personality disorder. Now, this is from the DSM-5. The DSM is the Diagnostics and Statistical Manual of Mental Disorders. Some people wonder what the difference between a mental disorder is and a mental illness is. Well, they are actually the same thing. But the term mental disorder is the more scientific term. However, the term mental illness is probably the term that is more used. So, in order to have borderline personality disorder, you have to have at least 5 of the following features. And I'm going to point out something that is often not pointed out. Even if you have 5 or even all 9 of these features, you don't necessarily have borderline personality disorder. For one thing, you also have to meet the general criteria for having a personality disorder, and if you don't have BPD. I will get to that criteria in a little bit. So, in order to have BPD, you must have at least 5 of these 9 features. The first one is frantic efforts to avoid real or imagined abandonment. And it says, note, do not include suicidal or self-mutilating behavior from criteria 5. The second one is a pattern of unstable and intense interpersonal relationships characterized by alternating between extremes of idealization and devaluation. The third one is identity disturbance, markedly and persistently unstable self-image or sense of self. The fourth one is impulsivity in at least 2 areas that are potentially self-damaging, e.g. spending, sex, substance abuse, reckless driving, binge eating. Note, do not include suicidal or self-mutilating behavior covered in criteria 5. And criteria 5 is recurrent suicidal behavior, gestures, or threats, or self-mutilating behavior. The sixth one is affective instability due to a marked reactivity of mood, e.g. intense episodic dysphoria, irritability, or anxiety lasting a few hours and only rarely more than a few days. The seventh is a chronic feeling of emptiness. The eighth is inappropriate, intense anger or difficulty controlling anger. For example, frequent displays of temper, constant anger, or recurrent physical fights. And the ninth is transient stress, related paranoid ideation, or severe dissociative symptoms. Then, in order to have borderline personality disorder, someone also has to meet all the criteria of having a personality disorder in general. According to the DSM-5, these are the criteria for having a personality disorder. A, the person must have an enduring pattern of inner experience and behavior that deviates markedly from the expectations of the individual's culture, manifested in 2 or more of the following areas. 1. Cognition, ways of perceiving and interpreting self, people, and events. 2. Affectivity, the range, intensity, lability, and appropriateness of emotional response. 3. Interpersonal functioning. And 4. Impulse control. B. The enduring pattern is inflexible and pervasive across a broad range of personal and social situations. C. The enduring pattern leads to clinically significant distress or impairment in social, occupational, and other important areas of functioning. D. The pattern is stable and of long duration, and its onset can be traced back to at least adolescence or early adulthood. So one thing they usually look for with something like BPD or any other personality disorder is if it is of long duration, because if somebody just has the symptoms of BPD for a short amount of time, it's not really a personality disorder and they don't really have it. And also, it should be noted that it does say that it needs to start happening by at least early adulthood. It doesn't happen later on in life. There is no such thing as late onset borderline personality disorder. So in order for someone to have borderline personality disorder and be diagnosed with it, they had to have at least been showing signs of it by early adulthood. Now, it is possible in some cases that maybe somebody wasn't actually diagnosed with it in early adulthood, but they still had it. But there's no way in which you can have borderline personality disorder that actually starts later on in life. E. The enduring pattern is not better explained as a manifestation or consequence of another mental disorder. And F. The enduring pattern is not attributable to the physiological effects of a substance, for example, a drug of abuse or medication, or another medical condition, for example, a head trauma. So now that we've talked about how BPD is diagnosed, let's move on to the information that shows that borderline personality disorder often can be cured. One of the better known long-term studies of borderline personality disorder is the McLean Hospital study. This is a study that, at least of 2018, is still ongoing. The study follows 290 people diagnosed with borderline personality disorder, and all of these people were inpatients at McLean Hospital, and all of them were inpatients because of borderline personality disorder. Now, one thing about this study is its limitations involve the fact that every single person in this study is someone who is hospitalized with borderline personality disorder. And the authors of the study even noted that this is a limitation. There are a lot of people who have borderline personality disorder that are never hospitalized. And there are a lot of people who have borderline personality disorder that are never hospitalized and never need any treatment. There are some people with borderline personality disorder that need treatment, but never as a hospital inpatient. And there are some people with borderline personality disorder that do need to be hospitalized as an inpatient. Now, generally speaking, people who are hospitalized for borderline personality disorder have it more severely than people who do not. So all the people in this study are people who had it severely enough that they needed to be hospitalized. But interestingly, what this study has found is that even the people who needed to be hospitalized for borderline personality disorder, in other words, the people who generally had it more severely, the prognosis for them was actually quite good. Also, according to the author of this study, everyone in this study with BPD was someone who was a young adult, at least when the study started, with suicidal concerns and less than optimal support at the start of the study. In other words, these were all fairly severe cases. As you can see from this chart, what they found was borderline personality disorder had a very high remission rate. At the 16-year follow-up, they found that 99% of borderline personality disorder cases had gone into remission. By going into remission, what they mean is they no longer met the criteria for borderline personality disorder. Now, like I said, everyone in this study met the DSM criteria for borderline personality disorder, but when they went into remission, they no longer met the criteria for borderline personality disorder. They found that at the 16-year follow-up, 99% had been in remission for at least 2 years, 95% had been in remission at least 4 years, 90% had been in remission for at least 6 years, and 78% had been in remission for at least 8 years. So that is actually a very high rate of remission. Now, when I say they no longer met the criteria for borderline personality disorder, I mean that they no longer met the DSM criteria, and they also no longer met the Diagnostic Interview for Borderlines Revised Criteria, or the DIBR. This is another way of diagnosing borderline personality disorder. And one thing about it is, as the author said, the people who also meet the criteria for borderline personality disorder under the DIBR have a tendency to be a more homogeneous group, and also fewer people meet the criteria for BPD if you include the DIBR, but everyone in this study initially met the criteria for borderline personality disorder using both methods. And when they went into remission, that meant that they no longer met the criteria for borderline personality disorder using either method. But that doesn't mean that all of the symptoms went away. If you think about it, like the DSM, first of all, you have to meet all the personality disorder criteria to have BPD, and then you have to meet 5 of the other 9 symptoms that the DSM listed that I put at the beginning of this video to have BPD. But if you have fewer than 5, then you don't have BPD. However, you could still have some of the symptoms. So some of the people who went into remission, they still had some of the symptoms. But that doesn't mean that they had BPD, really, or that it was not in remission, or that it was not cured. Because the thing is, if you were to take all the people that have some of the symptoms of BPD, like 2 or 3 of them, you would actually have a very large percentage of the population that would meet the criteria for BPD. And in fact, a very large percentage of the population doesn't have BPD. It's estimated that like 1.8% of the population have BPD, which is a lot. But if you were to, look at all the people that just have 2 of the criteria for BPD, it would be a lot more. So if you ask me, even if someone has some of the symptoms of BPD, but not enough to actually have BPD, then I say that they can still be cured of it. Because if you have a person that gets to the point where they wouldn't have been diagnosed with BPD in the first place, they no longer need any treatment for BPD, and they will never have a relapse for the rest of their life, then I think it is fair to say that they are cured. Now, one question about that is, what about the other 2 criteria? Since we do see that after 16 years, 99% get to the point where they no longer meet the criteria for BPD, what about the criteria that I made for being cured, which is that they no longer need any treatment for BPD? Well, it's not really clear how many people actually need treatment for BPD, but the author of this study did say that about 60% of the people at the 16-year mark did have ongoing treatment for borderline personality disorder. 99% of them had gotten to the point where they no longer met the criteria. But if 60% were still getting treatment, that means that 40% were not. So we do get to the point where at least 40% of people with BPD in this study meet at least 2 of my 3 criteria for being cured. They no longer meet the criteria for BPD, and they no longer need any treatment of any kind. And that includes psychotherapy or medications or any other treatment for BPD. So what about my 3rd and final criteria for being cured? My 3rd and final criteria for being cured is your BPD doesn't come back for the rest of your life. So the thing is, there are no studies that follow somebody who has BPD for their entire lives. But this study does go on for 25 years, although as of August of 2019, they've only published the data for the first 16 years. But when you talk about a study that's that long, you can pretty reasonably assume that if it doesn't come back, it's very unlikely to come back. And the data in this does show how likely it is for BPD to recur. And what they found is actually remission from BPD is relatively stable. It's more stable than remission from other mental disorders, although for other personality disorders, if you're wondering what OPD in this chart stands for, it stands for other personality disorders. That is a group of people. The study followed 290 people with BPD and compared them to about 70 or so people with other personality disorders. There were a variety of personality disorders. They did find that people with other personality disorders remitted more quickly. But still, people with BPD did remit. And once they remitted, their remission was stable. In fact, most of the time, even people who had remitted for 2 years, most of the time, those people did not relapse, the majority of the time. So they found that for people who had remitted for 2 years or more, they relapsed 36% of the time, which means they did not relapse 64% of the time. So the majority of the time, they didn't relapse. They also found that the longer you have remission from BPD, the less likely it is to ever come back. So for the people who had achieved at least a 4-year remission for BPD, 25% of them had a recurrence, which means that 75% of them did not. For the people who had a 6-year or longer remission from BPD, 19% of them had a recurrence, which means 81% of them did not. And for the people that achieved an 8-year remission, at least for BPD, only 10% of them had a recurrence, which means that 90% of them did not. From this data, we can say that probably a minimum, and this is a very conservative number, of 28% of people with BPD can be cured. How did I get that number? And remember, a lot more achieved remission of at least 2 years, 4 years, or 6 years than 8 years. And we know that 40% of those people don't require any treatment at all of any kind and are still in remission. And we know that 90% of those people will never have a recurrence of BPD. And we do the math, 78% times 40% times 90% is equal to a little bit more than 28%. In reality, the actual number is probably a lot higher. Why? Well, like I said earlier, we do know that there is a continuum of borderline psychopathology. And we do know that there are some people at one end of the continuum who have BPD but are able to recover spontaneously and never need any form of treatment. Now, I would consider all of these people to be cured. Unfortunately, I have not been able to locate any data on what percentage of people who have BPD will be able to recover spontaneously and never need any treatment. If you know of any data on that, please let me know in the comments. Then we have some people on the continuum who use non-intensive outpatient treatments but are never hospitalized. Then on the other end of the continuum, we have people who have BPD much more severely and become severely ill and use large amounts of mental health services, including repeated inpatient stays. Now, we know that the people in this study are actually far closer to the more severe end of the spectrum because all of them were people that were inpatients for borderline personality disorder. All of them were people that had to be hospitalized for borderline personality disorder. All of them had a relatively severe case of BPD. But even amongst the people that have it the most severely, at least 28% of them can be cured. And for the people that have it less severely than that, probably a higher percentage of them can be cured. And we did find that even with these people who had it very severely, 99% of them were able to achieve remission of their symptoms for at least 2 years. And when they say that there is some risk that you can relapse, even if somebody does relapse, it doesn't mean that they can't be cured, because if someone were to have a relapse, but then they go back into remission, and then they get to the point where they no longer need any treatment and never relapse ever again for the rest of their life, then they would still be cured. So we see that there's probably a greater than 28% of people that can be cured when you take into account the people that might have a relapse, but then go back into remission. Also, the statistics say that 40% of the people at the 16-year point were no longer in therapy, but we might see as it goes down the line to 18 years or 25 years, that maybe even a higher percentage of people with BPD no longer need therapy. In a book called In Fullness of Time, written by the lead author of this study, Mary Zanarini, I might be mispronouncing her name, it presents data that debunks the common myth that borderline personality disorder is not curable. And I gotta say, this is a very common myth. I am surprised at just how many people believe that it's not curable, including a lot of people that have borderline personality disorder. Now, my channel is a little bit different from a lot of other mental health channels. There are a lot of mental health channels that will say things like, well, mental health is just as important as physical health. Look, I'm not saying that that's not true, but it's the kind of thing that a lot of mental health YouTubers will say. But not every YouTube channel goes into how a lot of these mental illnesses, which a lot of people think are not curable, actually are curable. That's why on my channel, what I like to do is focus on dispelling the myths about mental illness. And I mean the myths that really are pervasive, like the myths that certain mental illnesses cannot be cured. you might want to check out my video, How to Cure Schizophrenia. I'll leave a link to it in the description. Schizophrenia may not be curable in all cases, but sometimes it actually is curable. And when I say it can be cured, what I mean is there are some people that have schizophrenia that can get to the point where they no longer have schizophrenia, they no longer need any treatment for it, including medications, and they will never have a relapse of schizophrenia for the rest of their life. It's a common myth that schizophrenia is not curable. And the science actually does back up the fact that schizophrenia can be cured in some cases. Getting back to borderline personality disorder, I did say at the start of the video that I will give all the details for at least one way to cure BPD. And that is, a lot of people with borderline personality disorder will simply grow out of it. It will go away spontaneously. And that can happen for some people, even the ones that have been hospitalized for borderline personality disorder. Now, I realize that you may not want to just wait for it to spontaneously go away, and you don't have to, because there are forms of therapy that have been proven to be effective for borderline personality disorder. Some of those types of therapy include cognitive behavioral therapy, dialectical behavioral therapy, schema-based therapy, and transference-focused psychotherapy. But there is some research that although these types of therapy are effective for BPD, it seems to be the case that none of them are actually more effective than the others. Now, I can't possibly give all the details about these types of therapy in this video, but I can give people certain suggestions to set them on the right track. One thing that will actually help your prognosis of BPD is the knowledge that BPD can be treated and actually, in some cases at least, can be cured. Now, I'm not saying that you should be overly optimistic, but you shouldn't be overly pessimistic either. And frankly, humans have a tendency to be more overly pessimistic than more overly optimistic. There are some exceptions. It is overly pessimistic to think that borderline personality disorder can never be cured. That's not what the science says. That's not what the research says. In fact, most of the time, even for the most severe cases of BPD, BPD can go into full remission, and a lot of times, BPD can be full-on cured. Maybe not all the time, but a lot of times. So, while you don't have to be overly optimistic, it is a good idea to be cautiously optimistic. It is far better to be cautiously optimistic than it is to be overly pessimistic, and believing that BPD can never be cured in any case is absolutely overly pessimistic. The author of the study that I cited earlier in this video, the McLean Hospital study, said in her book, In the Fullness of Time, that one of the main factors in how well somebody with BPD does is the strength of the person's will to get better. She writes, some borderline patients have a strong fighting spirit, but others have such a strong need to have their inner pain affirmed, or such severe experiential avoidance of anxiety-provoking experiences that they gradually slide into the role of chronic patient. She also says that in many ways, the differences between people with BPD that do get better and people with BPD that don't is that some borderline patients have a strong sense of agency and hopefulness about the future, and those are the ones that succeed. And there are others that have a firm belief or hope that the rules of life do not apply to them because of what has happened to them. I suspect that some of the people with borderline personality disorder that fall into the latter category, the category of people that are more likely to fail, might actually be hostile to the idea that borderline personality disorder can be cured because, and they probably will not acknowledge this openly, but they may feel that if their borderline personality disorder cannot be cured and that it is seen as incurable, that will help them in their firm belief or hope that the rules of life don't apply to them, because they might be hoping that the rules of life may not apply to them since they have borderline personality disorder. But the people who have borderline personality disorder that try to use borderline personality disorder as leverage in that way are doing themselves a disservice. It is far better to embrace the fact that it can be cured because A, it is a fact, and B, the fact that it can be cured is actually quite empowering. And it also is true that people with BPD that know about the fact that it can be cured actually are more likely to do better than the ones that don't know about it. So I am not doing a disservice to anybody by telling them the truth that BPD can be cured. I know that some people will try to act like I'm doing a disservice, but I'm not. Telling people the truth about how borderline personality disorder can be cured is actually quite beneficial to both people who have BPD and people who don't. Another bit of advice is to realize that there are certain things about borderline personality disorder that somebody with BPD absolutely can control. For example, somebody with BPD absolutely can control their behavior. It is true that it can be a little bit harder to control your inner experiences and inner emotions, but people with BPD can control their behavior. And the author of this study actually did point this out in an interview.
I think you outgrow it, you think about it, and you say to yourself, gee, my relationship's really stormy. Do I want to continue this behavior, or do I want to stop it? Or yelling and screaming at people hasn't worked too well for me. What else can I do? That's not true if you're delusional or hallucinating or so depressed you can barely move. People with BPD have a choice with some of their symptoms, not the affective ones or the cognitive ones, but they sure have a lot of choices with the behavioral ones and the interpersonal ones. Nobody is forcing you to behave this way, and I can help you behave in a more mature, straightforward way to help you get what you want.
So, changing your behavior if you have BPD is something that you actually can do, and it's something that you can start doing today. It's something that you can start doing right now, because nobody with BPD has to behave in an immature fashion. And that stated, a lot of times people with BPD do behave in a way that is actually rather immature for their age. And I am not trying to pick on people with BPD in saying that. It's just something that has been noted by a lot of psychologists. Jordan Peterson, who is a psychologist and professor of psychology, noted that a lot of times people with borderline personality disorder can behave as if they're 2 years old and sometimes throw temper tantrums. They don't all throw temper tantrums, but some of them do. And when someone is 2 years old, they can get away with throwing a temper tantrum. But when someone is 15 years old or 25 years old and they're throwing a temper tantrum, it can be quite off-putting. But nobody with BPD has to behave that way. All of them actually can change their behavior. Now, it might be the case that some of them may be reluctant to change their behavior. They might think that behaving in the way they behave actually helps them get what they want. And maybe in the short term, doing something like, say, throwing a temper tantrum might get some people to appease you. But honestly, it's not really the best way to get what you want. And it's actually far less effective at getting what you want than you may think. And it is indeed true that you can change your behavior if you have borderline personality disorder. The other thing is, one of the types of therapy that is considered useful for BPD is cognitive behavioral therapy. Cognitive behavioral therapy is a combination of cognitive therapy and behavioral therapy. Behavioral therapy is predicated on the idea that if you change someone's behavior, you can ultimately change their internal state. So if somebody behaves in a certain way, eventually they will actually feel a certain way. So while it may be the case that if somebody with BPD changes their behavior, it may not have as fast of an effect on their inner state, eventually it actually could affect how they feel internally, and it also will improve their interpersonal relationships. Now, I'm not saying that I think that behaviorism is the end-all be-all, but I do think there is some truth to the idea that you can actually change someone's mental state by changing their behavior, even if the change in their mental state lags behind. So hopefully these tips can set people with BPD off in the right direction. And like I said earlier, just knowing the fact that BPD actually can be cured is empowering and will actually help you improve and perhaps even cure BPD if you have it. Thanks very much to my producer, Lena, aka Lollipop, and associate producer, Jamie Joy. I have a new Patreon perk. If you would like to be credited as a producer on all my videos, you can for $50 or more a month. And if you'd like to be credited as an associate producer, you can for $5 or more per month. Check out my Patreon link in the description if you'd like to contribute. Thanks to everyone for supporting my channel, and if you like this video, go ahead and give it a like. And if you aren't already, subscribe to my channel, click the bell icon for notifications, and together we shall take over the world. You can also catch me on Instagram, Twitter, Twitch, and Snapchat at Zorkmid123.